Hi everyone, it's Dr. Salcedo, your conscious gynecologist. I'm so glad you're here. Today we're going to be doing a video on GLP-1 receptor agonists, yes, the GLP-1s, and how they play a role in gynecology. I know you're really excited about this video. I'm going to do a video today just on what they are and how they impact gynecology, and then I'm going to be doing another video on how they specifically affect me and the potential to affect in endometriosis. So stay tuned for that one. So what is GLP-1? GLP-1 is glucagon-like peptide 1, and it is a protein that is synthesized by the intestinal cells and also some areas of the nerves in the brain stem. Its release is stimulated by nutrient ingestion and also some nerve stimulation from neuroendocrine effects. So what is a GLP-1 receptor agonist, which is like all of the medications that you're hearing about online? Well, a GLP-1 receptor agonist is a protein that is almost similar to the GLP-1, but it has been modified just a little bit in order to be rendered to be able to have a longer half-life in our body. It actually is resistant to one of the degradation enzymes called DPP1 inhibitor, and it will allow your body to have this GLP-1 receptor agonist for a longer effect. So the actual half-life, or how long the GLP-1 protein that we naturally make in our body, is only about 1 to 2 minutes, but the GLP-1 receptor agonist, the actual medication, is resistant to degradation or breakdown by our own body's natural enzymes. So what does the GLP-1 receptor agonist do to our body? Well, the metabolic response is that it delays gastric emptying. That means that it slows down the food processing in our stomach and our intestines. It suppresses glucagon release, which means that it reduces the amount of sugar that's released from something called glucagon. And it also enhances our secretion to insulin. That's kind of cool, right? And it increases satiety, which means that it makes us feel full using like the peripheral mechanisms of like our actual stomach and the sensors that we have in our stomach that when we feel full, but also the sensors in our brain. So where are the GLP-1 receptors? Well, mostly they're in our pancreas and in our lung, but there is a little bit of more of an expression also found in the heart, the kidney, the intestines, and the brain. And actual newer research is showing that we can find them in the ovaries, the testes, and actually in the lining of the uterus. Now, what are the neurobiologic effects? Like, how does GLP-1 affect like our nerves? Well, it actually protects our nerves and it improves the neurologic function, and it reduces inflammation and oxidative stress. And also kind of helps a little bit with like some mood disorders too. So because it does that, then it really helps a lot with inflammatory pain because it promotes beta endorphin release. It inhibits oxidative damage. It's anti-inflammatory. So that's pretty good. We see that we are using GLP-1s off-label for a lot of immunologic disorders, nerve disorders, and yes, we'll talk about endometriosis later. So how does GLP-1 receptor agonists help with like PMOS and metabolic derangements like metabolic syndrome? Well, because GLP-1 receptor agonists improve insulin sensitivity, it helps by improving our HOMA-IR and our insulin levels. And because of that, it's going to help improve our menstrual irregularity, because if our insulin levels are normal, then they won't be high and they won't block ovulation. And so that's really helpful. It actually improves our spontaneous conception rate, and it stimulates follicular development over at the ovaries. And the interesting thing is that it's actually improved pregnancy rates when we look at head-to-head trials between metformin and GLP-1 receptor agonist peptides. GLP-1s have actually shown to be better at improving spontaneous pregnancy rates. And the interesting thing too is that if you're utilizing IVF, then it actually improves implantation rates better than metformin would. So there are some concerns about GLP-1 receptor agonists and fetal and neonatal outcomes and pregnancy overall. So observational studies show that there's no increased risk of congenital malformation or adverse pregnancy outcomes with periconception, which means like around the conception or early pregnancy GLP-1 exposure within women. However, there are some registry reports where people who are reporting an increased risk of some teratogenic or malformations that were noted among women who were exposed to GLP-1s in the first trimester. Now, it's important to note that women who are on GLP-1s, many of them are not metabolically healthy. And so it's hard to really delineate at this point whether GLP-1s are the true culprit for some of the teratogenic effects, or if it's just because of the basis of being not metabolically optimized before pregnancy. So how does GLP-1s affect reproduction, and like how do they affect like our ovulation and our pregnancy rate? Well, the really cool thing is that there are lots of GLP-1 receptors at the hypothalamus, and that's the area of our brain that triggers ovulation. And so because it seems to modulate the activity of the hypothalamic axis that talks to our pituitary and our ovaries, it does seem that there is some improvements in ovulation, because not only does it help improve insulin levels that allow us to ovulate, but it actually also helps us utilize some of those receptors in our brain and our hypothalamus that receive the signals to ovulate. So that's really cool. It does help a lot of women who just maybe need that little push. And so, we know that when you have your periods and then they're regular, then that means that you're in a really great metabolic state, and GLP-1s might be able to help women with that. We know that there are GLP-1 receptors in the ovary, and that is a good thing, because if we have GLP-1 receptors in the ovary, then they're reducing inflammation that may be part of like the PCOS, PMOS cascade. And if it's helping with ovulatory function, then it could definitely help with spontaneous pregnancy rate too. And so that's why GLP-1s and fertility has been showing a lot of improvements. In fact, among women who are diabetic, GLP-1s have actually helped improve anti-Mullerian hormone, which is a hormone that's produced from the follicles of the ovary that indicate our ability to ovulate. What about the role of GLP-1 within the lining of the uterus? Well, within the lining of the uterus, there are GLP-1 receptors, and if it does help improve inflammation, it will help improve inflammation at the lining of the uterus too. And so if you have vessels at the lining of the uterus that are inflamed, you're going to bleed more. And so we're seeing that GLP-1s are improving the scarring and the inflammatory signals that are seen at the lining of the uterus. And it's possible that this can help with heavy periods too. We just don't really know exactly if that's the case. There's no studies that look at heavy periods and GLP-1s, but there is a study that looks at one of the GLP-1s called exenatide that decreased the degeneration and fibrosis of the lining of the uterus in diabetic rats. So, hey, maybe we can translate some of that science. But we are noticing that because the GLP-1 receptors are in so many different places, and because it's within our system a lot more, then it's very helpful for that reduction of inflammation that is seen in so many women who are struggling with metabolic dysregulation. So it's important to note that some of the GLP-1s, because by nature of their delayed gastric emptying, the manufacturer of certain GLP-1s recommend that women use backup contraception for 4 weeks after they initiate their dose or any dose escalation due to the potential effect of the reduced efficacy of certain birth control pills that are taken orally. And we know that because a GLP-1 may improve ovulation, it does increase your unintended pregnancy risk. Now, it's also important to note that GLP-1s still remain contraindicated during pregnancy. So that means that we don't recommend folks use GLP-1s during pregnancy because of the animal teratogenicity data that is out there. And so the recommendation by and large is to stop your GLP-1 about 2 months before intended pregnancy to hopefully reduce that concern. The bigger side effects are that a lot of people have some nausea, vomiting, dizziness, constipation, bloating, rare risk of pancreatitis with the GLP-1s. And then there is some interesting data that also shows there's an increased risk of negative mood disorders and even suicidal ideation that's related to GLP-1 receptor agonists too. So it's important to really have a good discussion with your doctor when you initiate something like that. And also we recommend that folks stop their GLP-1s about a week before surgery, just because of the gastric emptying issues also when it comes to general anesthesia. So I hope that you felt this video was helpful. I feel like it's been a long time since we've had a chance to talk about some good stuff in metabolic health and gynecology. Go ahead and stick around for the next video. We're going to talk about GLP-1 specifically related to endometriosis. If you're interested in a consultation, check out consciousgynecology.com and I'll be able to help you. My personal mobile phone number is there, and as well as my email address and a way to make an appointment. I would love to help you through your specifics of your journey.